Hey everyone, it is October 20th, and it's another day. I guess the old people used to say it's another day's journey, right? I'm glad about it somewhat.
Yeah.
So this is today very touchy subject for me. I seen an article the other day, and I think we have a portion of it for us to bring up. Do we? Maybe it's coming up. But the article is about a man down in Rockdale who had been in the hospital. He had been in the hospital, and um, I guess at a certain point, his Medicare gave notification to the hospital that they were not gonna be covering him or something like that. The hospital, to their record, they put out a statement saying that they had given a guy other options, right? Before they put him out, but they put him out, and he still had tubes in some of his body. And the police, the sheriff, I think, of Rockdale County, ended up being the one to come out and get him and end up publicizing this article. And it's just a reminder of our healthcare system and how important it is to us as a nation. Like, one of the things that's really interesting is that I remember the movie John Q, and it
Right.
is so powerful. But the storyline of it was about a man, literally, who son needed heart surgery, and he couldn't afford to get his son the heart surgery. So when he couldn't afford to get his son the heart surgery, he did the best thing he could do in order to make sure his son lived. And I
Right.
remember a part of the movie, he said, my son would not bury me.
Right.
I would bury my son. And I don't know, the healthcare system in America.
Man, it's atrocious. It's all about the dollar. Bottom line. I mean, if you can't pay, you or your medical benefits run out, they put you out.
Yeah.
And it's unfortunate because this ain't the first time that this has taken place. It's taken place on, two or three other times in two or three different cities. And so it's one of those things that it's been going on for so long, it's actually pretty
Yeah.
commonplace. And that's a shame.
One of the things that I find interesting about this is that we literally have a system that says that you can't afford to get sick, if that makes sense. And I think that was kind of exposed even during COVID time,
Yeah.
a little bit, because we have so many people, and you know me, my story is different, right? So
Right.
I started out with my situation 4 years ago, and at the time I think I was on an Obamacare plan, and I remember getting extremely sick. That I ended up needing a special or I needed a GI doctor, but there was a special GI doctor in Atlanta that everybody was referring me to. And I remember going and seeing him, and I remember when I walked into his office, I was like, I don't have insurance that you take. And he literally looked at me, he said that, don't worry about it, we'll deal with that later. But for right now, let's not worry about that, right? Let's worry about trying to get you better. But it's not a lot of doctors out there who would do that.
Right.
And luckily enough for me, by God's grace, I was able to finally find a job and get back to work and have insurance that he took. But not a lot of doctors out there that do that. And it's sad when we have so many different people out here who can't afford to allow if their babies are sick or they're sick, or some people who go to work, and even COVID exposed it a lot, because we had people who were really afraid and really at risk. And I even speak from the perspective of being in restaurant management, people who really should not have been out during the midst of the height of COVID, when we didn't have a lot of answers that we have now.
Right.
Who took the risk of being out because they couldn't afford to get sick first off and be off from work, but they couldn't afford to get sick and have to go to the hospital. And so many times people will stay home and not go get the treatment they need because they don't have insurance, or because they know the insurance won't cover it, or because there's this high deductible.
Right.
And we talk so much about other countries, and about countries like Canada or countries like Cuba, who have what we call a open system of healthcare. And most of the time we try to say that they have an open system of healthcare, but the healthcare sucks. But the reality is, the reason why the healthcare is overexpanded in places like Canada is because the fact that everybody has access to it does overload the system. So it's not about the system sucking, it's just about making sure that we bring more doctors and more nurses and more hospitals into the system so that we can even it out for people. But at the end of the day, a person should not get sick and have to be afraid of getting sick, or be afraid of going to the hospital, or being put out of a hospital, when this guy, and I think the article said he may have had a sepsis, and a sepsis is a blood infection. It can literally kill you.
Right.
He had a sepsis, and he may have had a urinary tract infection, I think the article said. And they put him out before he can even finish his treatment. But I know we have two videos that we're going to show, too, of other people who were in the hospital who may have gotten kicked out. Let's check this out.
A hospital in Baltimore is investigating the treatment of one of its patients. Staffers left the woman dressed only in her hospital gown near a bus stop last night in the freezing cold. Jeff Pegues has this story.
So y'all just gonna leave this lady out here with no clothes on?
Overnight, Mamu Baraka was walking past a Baltimore hospital when he noticed something he says he'll never forget.
So I'm assuming that you all are with the security department? Okay. Is there a supervisor available?
The hospital's security guards had just wheeled a patient to a bus stop, and in the freezing temperatures, they left her there. The only thing she had on was a hospital gown.
It's about 30 degrees out here right now. Are you okay? Are you unable to speak? Are you okay, ma'am? Do you need me to call the police?
It's called patient dumping, and it doesn't just happen in Baltimore. In 2007, 60 Minutes investigated the practice of removing homeless patients from Los Angeles hospitals and leaving them downtown. Often the patients are not insured or have other financial issues. It's unclear if that was the case in Baltimore.
Go ahead and sit down. Okay, ma'am, go ahead and sit down. Thank you. I'm going to call to get you some help.
In a statement, the University of Maryland Medical Center said they share the shock and disappointment of many who have viewed the video. In the end, they say we clearly failed to fulfill our mission with this patient. The man who recorded the video.
So, I mean, that's just another, I guess, interestingly enough, another example. And then it's crazy, too, because I think by the time I've been in the hospital, they won't even allow you to leave with an IV in your hand. And we seen like this lady had an IV in her hand. We seen that the video, the other person had an IV in their hand. And just the risk of a person who are definitely homeless being thrown back out to the streets with just an IV in their arm or their hand. I mean, the risk, like.
See, but if you're homeless, the assumption is that there's no one that they can contact or who's going to find you missing.
Right.
You know what I'm saying? So, you know, well, if they happen to die out on the street, you know, no one's going to miss them. They're just going to be a John or Jane Doe. And then who knows if that's one of the things that they're even, you know, caring about. If that even factors in that it's just one less person that they don't have to deal with. You know, but it's really sad, man, and it's actually pretty. I'm kind of getting a little enraged about that because it's just really doesn't make any sense, man. And I understand it's all about the dollar and everything, but you're talking about a human life, and what you're showing us is that the hospital doesn't care.
Yeah, and the funny part is that as a citizen, we have to understand that if we don't take care of these people on the end of health care, we ultimately have to take care of them in some way, fashion, or form. And that's when we see hospitals who are overburdened and they've taken on so many cases, and then now we have to do bailouts for hospitals. Ultimately, we pay for it. And I think we pay a lot more for it when we don't offer people health insurance. When I find it amazing how some of these states that have not expanded Medicaid, and Georgia's one of those states, and now we see Georgia putting somebody out. I think we have another video we're going to show here.
Here, all new at 6. Police wanting answers after they say a local hospital had security escort a very sick man out of a hospital. Someone called 911 after finding the man collapsed just steps from the front doors. He still had medical tubes coming out of his body and ended up in the ER. Channel 2 investigative reporter Mark Winnie now live outside Piedmont Rockdale Hospital. Mark, you talked to an officer who helped rescue the man.
Yeah, we went to an address where the patient had apparently lived. We tried him by cell phone. We got a statement in behalf of the hospital, but we also have reviewed police documents, interviewed a Conyers police deputy chief, and reviewed a 911 call. And those things say a lot.
Conyers 911, where's your emergency?
Hi, sir. I am leaving out this medical complex, and there is a gentleman, looks like he just came from the hospital, but he is passed out on the ground.
Common sense dictates that you do not treat human beings the way that we're seeing in this particular case.
He's not responding. I don't know if he's okay or what.
The call came to Conyers 911
It's at the Piedmont Rockdale Hospital.
from a concerned citizen.
Poor guy. But probably needs an ambulance, but he's right in front of the Piedmont Rockdale emergency entrance.
Says Conyers Police Deputy Chief Scott Freeman, who says he's concerned too about the circumstances of a 68-year-old man's discharge from Piedmont Rockdale Hospital Thursday based on what he and other emergency responders saw firsthand or later learned.
He was clearly incoherent.
Freeman says one of his officers documented that a hospital employee said the 68-year-old man had been staying at the hospital 35 days, that Medicare would no longer continue to pay for his treatment at the hospital, and that security dressed him and walked him out. The deputy chief says an officer was told the man was, as a report says, cleared as fit to leave by 2 physicians, and the hospital wanted him gone.
I don't have a good feeling about it. I think it's inhumane.
A statement says, at Piedmont, our purpose is to make a positive difference in every life we touch. We can only provide the best care with the cooperation and consent of the patient. It adds, we do our best to connect patients in need with community partners and social service organizations to provide appropriate after-hospital care, but ultimately accepting these services is at the discretion of the patient.
Literally ejected out to the sidewalk with no help whatsoever. That's just not how we treat people here in this city or this county.
Freeman says National EMS and Rockdale Fire responded, and a paramedic told him the man had a fever, signs of sepsis, which Freeman says is a dangerous internal infection, a urinary tract infection, an elevated heart rate. He says he was loaded on an ambulance to go to the ER.
He needed to be in the emergency department.
Now, Piedmont Healthcare says, unfortunately, hospitals often find themselves caring for people who cannot get into the kind of facilities that bridge the gap between hospital and home. Freeman says that a hospital employee indicated when asked where he wanted to go on hospital property other than inside, the man said Milstead Road and Milstead Avenue, and that's where Conyers Police found him. We sought a response from Medicare. An email said, "We are working this for you." Reporting live in Conyers, Mark Winning, Channel 2 Action News. So again,
Disgusting.
Yeah, again. So, I mean, and even that, I mean, my thing is that, again, when did we start letting people leave out the hospital with a catheter on? I mean, the guy had a catheter on. I'm so confused.
Even if he's fit and, medically fit for discharge, you didn't even do your due diligence to remove the tubes out the man's body.
Yeah.
So that, to me, like the officer said, that sounds, well, I'm paraphrasing, but it sounded a bit shady to me, that you would put him out, say he claim he's fit to be released, and then put him out with all the tubes, get him dressed, and then send him out with tubes in his body.
Yeah, I think that, I mean, again, when we talk about America, even bigger, healthcare is a huge, huge disappointment.
It is.
And hospitals have become so commercialized that we have stepped away from it being about people, and it's really about money. It's about, it's no longer about people. And when money gets involved in things, it seems like we lose a lot of the mission of people, if that makes sense. And I hope that as a country we can do better. I know that in the bill that they're trying to propose now, the Build Back Better bill, there's money out there to help with Medicaid, there's money out there to help with Medicare, and help people who can't get access to health care to be able to get access. So, I mean, I recommend to people, go to www.healthcare.gov, try to find a cheap plan. At least some plan is better than no plan.
Right.
And I know it's not the best option, but some plan is better than no plans. But this is a conversation I think that as a country we have to get serious about, and we have to start having, because people are dying while we're sitting here worried about this pettiest of stuff. And this guy right here, thank God that good people found him. And it's again too, what I'm really proud of is this is an African American man, and this is a white police officer who found him. And for him to be standing up and saying that, it reminds us that that everybody who wears a uniform is not a bad person, right? No matter what race or creed you come from, it's not a bad person. So we really got to continue to have a discussion about healthcare, and maybe we could bring somebody on who's maybe running for health secretary of the state of Georgia, and try to see if they can come talk about some things we could do differently in Georgia.
Yeah, that would be that's a good idea. And I tell you, it's because that kind of thing, it could be any one of us. At any at any time, any given moment, you get sick and your health care is not up to par, or you just don't have any. That could be you.
Yeah.
You know, and it just real easy. You stay there for 2 or 3 days, a week or whatever, and that could be the end of it for you. And now you're out on the street trying to figure it out. And like you may mention earlier, about the financial side of it and everything. A lot of people go without health care because they have to it's so expensive.
Yeah.
Even the deductible, people are trying to make decisions,
yeah.
Pay the bills or eat, and or do I pay to get the kids medicine?
Right.
So these are some of the things that there are some programs that are out there, to help supplement the cost, but is it enough? That's really the question. Is it enough to take, if someone who is financially challenged, or maybe they just, maybe they're working at Taco Bell or something, and they're just not making enough to make ends meet, and they come across a situation like this, how does health care come into play for them long term? Short term might be okay. You're in and out, maybe an outpatient surgery, and that's it. But what if you need a longer stay? What if your medicine is, $500, $500 a month?
Yeah.
You're talking about that plus whatever your rent and utilities and car note, whatever you have, might be. And so, you have a lot of people going without health care, or going without taking care of themselves or their families the way that they should.
And some of them, their jobs offer health care, but it's just so expensive that they don't even want to participate in it because of the amount it costs.
Yeah.
Some people, I remember I used to tell a person before, they was like, what do you work for? And I said, I work for my health insurance, literally. Because by the time I got my check and they took out for health insurance,
it wasn't anything. Yeah.
So, we just want to keep in mind that it could be any one of us at any day and time that could be in that situation. So, let's continue to pray, I guess, for the healthcare system in the United States, but let's not be silent on it. And this needs to be something that we continue to talk
Absolutely.
about. But we want to continue to remind everybody that we have a really, 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 really hot event going on. If you're in the Cobb County, Paulding County area, join us on October 23rd at 4 p.m. at Courageous Church, where we'll be hosting our second One Accord Conference. Come out, man. We have some powerful, dynamic speakers. And you can go to our website at www.blackpush.org, or go to our Facebook page to find out more information about what's going on Saturday. But we are excited, and we hope to see you there.